Attorney Mark.
Good afternoon, everyone. Thank you for spending your afternoon with us. So just waiting for the other participants to log in or to join our meeting. Then we will start in 5 minutes. Thank you so much. So I would just like to welcome our resource persons. We have Councilor Mahipos. We also have Engineer Lacandiwa of Senro. We also have Curtis from the City Health Office, and of course our Regional Director of the Environmental Management Bureau, Dr. Son Manuel, and we also have Ms. Eileen Lucero of the Eco Waste Coalition.
Murag nag-feedback, nagkakuha no?
Si Attorney Mark Day ang lawyer na ni.
So good afternoon, everyone. Once again, would just like to remind everyone, no, sa tanang participants, na we have participants also outside Davao City and outside Mindanao. So maybe we will use English or Tagalog in our conversation so that the other participants will understand us. So we will just adjust no, sa ato ang mga other participants who are outside Davao City. And I would just like to remind everyone that your microphones will be put in mute, no? So that we will just focus on the resource persons while they are talking. And if you have questions, you can just type or message, no, sa ato ang chat box. You can type your questions there, and we will read them after all the resource persons have talked. No, so we have 5 resource persons. The open forum will be after all the resource persons have already spoken. So thank you.
So dapat masulat din ang mga issues and concerns. Sulat.
Okay, everyone, let's begin our webinar. So this will be the new normal na siguro, no? When we do our forum because of the COVID-19. So before we formally start as how we start our program, no, we will start with an opening prayer. So may I request our watershed network organizer, coordinator, Miss Judy Ann Enriquez, to lead us in prayer.
Holy Spirit, Amen. Mahigugmaon ug balaan namong amahan kami nagaampo o nagapangamuyo kanimo ug magbalig-on ang tanang katawhan sa tibuok kalibutan ug ilabi na ang nasod sa Pilipinas. Ug magmalampuson ug mabatukan ang nasinating krisis kabahin sa COVID karong panahona. Ug magsunod sa mga balaod nga gipa-implementar karong panahona. We pray for safety and protection labi na sa atong mga frontliners karon ug hatagan sila og kusog kapiskay sa panlawas aron mapadayon ang ilang pagserbisyo. Sa mga public official and mga decision makers, we pray for wisdom and guidance. Ug ilabi na ang atong amahan sa nasod nga unta magmalig-on ug ana sa maayong panglawas. Ug aniya kaniya ang gugma sa pagpailob ug pagsabot sa tanang katawhan. Be with us, Lord. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen.
Our webinar entitled Flattening the Waste and COVID-19 Curve. So while we do, while we encourage everyone to stay at home and keeping so naata karon aning platform, we should utilize available platforms to educate and inform everyone kung unsa tong ato mga dapat buhaton. Dili dapat buhaton when it comes to pandemic like this, while we to curve the or to flatten the curve of COVID-19, we should also aim to curve also, or flatten the waste, our waste problem. So with that, naatay mga gi-invite na mga resource persons who are we are very grateful, that they allot their time with us to enlighten us with the different policies that the government has issued with regard to waste management, especially in healthcare waste management and mga municipal waste. So before we formally start, I would like to ask our team director for her welcome remarks. Thank you.
A blessed afternoon to each and everyone. Thank you for being. Sorry.
Hello.
I
Good
request our
afternoon,
executive director,
everyone.
Chinky Piliñugolye, to give her welcome address.
Yes. Thank you, Mark. Good afternoon, everyone. Maayong hapon sa tanan. In behalf sa Interfacing Development Interventions for Sustainability, I would like to welcome everyone to our webinar. This is the first online forum organized by EDs, and we hope to organize more of this in the future as part of the new normal, as mentioned by Mark also earlier. So we are very thankful to everyone for making time to participate in our online forum. Special thanks to our resource persons, to RD Sophie Manuel, to Sir Curtis Lizaraga, to Engineer Lacan Arculio, to Miss Eileen Lozero of Eco Waste Coalition, and of course, Councilor Justado Mejipos Jr. So this afternoon, or this online forum was organized in order for us to be updated on how our wastes are being managed. This is Davao City. We've been locked down for more than a month now and extended po ang ECQ until May 15. And after that, we don't know kung GCQ na bata or hopefully no GCQ, and eventually maabot na nato ang new normal. And while our attention is focused on the health concerns, on the rising or recoveries or the number of deaths na affected by COVID-19 pandemic, we at EDs also thought that it's also good, or there's a need to also check on the environmental concerns like the waste management in Davao City. So this afternoon, we hope to answer the following questions, no? Our resource persons are here to really answer this question. So one, I think we will try to answer the question how the city government manages our wastes. No, are we doing well or not? Are we disposing our medical wastes or not? And then also our waste pickers, are they okay? Our garbage collectors, are they okay or not? And also question on what are the new policy issuances in terms of waste management, particularly on healthcare wastes, no, our medical wastes. Also, we will try to answer the question on how are we, the Baweños, are informed, no? And are we really complying with the new environmental policies or issuances? And then, of course, no, our favorite subject, ito yung ating focus ng ating discussions before the ECQ. What are the effects of single-use plastics, including the single-use PPEs to the environment? And what are the updates? Ito yung pinaka-excited din kami. What are the updates on the proposed single-use plastics regulation of Davao City? So those are the questions that we want our resource persons to answer this afternoon, and hopefully you will be with us until the end of this webinar. So thank you, and we hope we will have a meaningful webinar this afternoon.
So thank you, Ms. Chinky Penyugolyan, for your welcome address. So to start our program, may I request Mr. Curtis Larazaga, the Chief Health and Sanitation Division of the City Health Office of Davao City, to discuss with us policies or what are the initiatives or programs of the City Health, of the local government unit of Davao through the City Health Office, with regard to the management of healthcare waste. So, sir.
Hello, Attorney Mark. Hope everybody's fine. Well, firstly, I'd like to focus on the areas of concern that we have within the city. Because currently I want to focus on the isolation units or the COVID stations that we have. Currently, we have 4 COVID stations, which are in Malagos. We have at La Vida Inn. We also have at Crossing Bayabas and at Santa Ana Health Center, which is at Magsaysay Park. Another area of concern for healthcare waste also is where the RAT, the Rapid Action Team, is the RAT is, which is assembled also at Magallanes. Now, all these healthcare waste coming from their PPEs and other infectious waste are handled properly by a treatment facility, which is called Maya. And all these wastes are regularly collected by CLAD. CLAD is the collector for this waste, type of waste. And this is delivered to their facility, the treatment facility in Carmen Tugbok, which is near our sanitary landfill. It's separate from our sanitary landfill, where it goes through a process of pyrolysis. It's actually a kind of treatment system which involves high temperature, more than 120 degrees centigrade, and the healthcare wastes are being exposed to 15 minutes. That is as per the OH guidelines. And when they are already treated at this number of minutes, they are being shredded off to reduce the waste being treated. Those are the main concerns that we have, especially in the city, because the healthcare waste facility, the healthcare waste in the hospitals are already in place. And then in the barangays, we have also our BHERTS, the Barangay Health Emergency Response Team, that go to the areas where there are persons under monitoring, in which proper hygiene and the disposal of waste are being advocated on them.
Okay, yes, sir. Curtis, so thank you for that. May we request everyone, if you have questions, you can just message us, no, through our chat box, so that your questions will be entertained later on after the resource persons have finished their opening statement or messages. So thank you, Sir Chris. So after that, because of the healthcare waste, how do we transport this waste from the hospitals or to the healthcare units to the endpoint? So to discuss that, may I request Dr. Sophie Manuel of the Regional Director of the Environmental Management Bureau. Ma'am?
Well, good afternoon to each and everyone. I do hope that everyone's fine. Well, I was tasked to discuss today on the topic managing hazardous waste in time of pandemic with emphasis to the three memorandum circulars issued by the EMB. So the outbreak of coronavirus disease, COVID-19, has been declared a public health emergency of international concern. And in view of the implementation and pursuant to the need for the continuity of operations in the field of public health and safety, an interim guideline consistent with the Department of Environment and Natural Resources DAO number 2013-22 is being implemented for the unhampered transportation of hazardous waste, specifically waste coming from the healthcare facilities to the treatment, storage, and disposal facility. So this was the very reason why EMD Memorandum Circular 2014 was issued. And it, as a basic policy of the state, there is a need to continuously monitor the transportation, storage, and disposal of hazardous waste in order to avoid environmental contaminations and to provide temporary protocols for waste generators, transporters, and treaters, local government units, law enforcement authorities, and other stakeholders in the smooth implementation of proper waste management. For Section 3 of the DAO, it discusses the coverage that this interim guideline shall be for the registered transporters and registered treatment, storage, and disposal facilities, which respectively house and treats and disposes of healthcare waste. However, in 2014, it emphasizes that this only within the island of Luzon. That is why 2020 MC 2020-16 had expanded, which later I will explicitly discuss. No, and Section 3 of DAO 2020-2014 emphasizes the exemption on the travel ban because being a basic necessity and activity in the delivery of health and sanitation services, the movement and operation of duly registered waste transporters to collect the pathological infectious waste from healthcare facilities should not be hampered. Hence, during this period of the enhanced community quarantine, these transporters shall be exempted from the usual prohibitions in the checkpoints against transportation and operation upon presentation, of course, with the documents, their name and transport ID identification, the waste class and waste number, and signage corresponding to the waste being transported. The Section 4 of the Memorandum Circular stipulates the simplification of the existing procedures. So, six existing procedures for the issuance of the permit to transport for registered transporter for hauling to and from healthcare facilities and TST facilities have been simplified. It is they can now submit their application for a special permit to transport through email by providing details like their official letter request, their transport registration certificate, the treatment, storage, and disposal registration certificate. Of course, their transport management plan is very vital. Their schedule of handling and delivery to the treatment, storage, and disposal facility, the route plan, the memorandum of agreement between the generator of the waste, the transporter, and the treaters. Explicitly emphasized in Section 5 of MC 2020-14 is the safety protocols of the transporter, which they must follow. So the registered transporter must implement a health and environmental plan in order to protect the public from the potential risk of exposure to COVID-19 virus, and a report of compliance must be made after each completed transport. So waste transporters vehicles shall have all the required markings attached to the sides and back of the conveyance. So the markings must be appropriate, legible, and readable up to 50 meters from the vehicle. And Section 6 specifically states that the collection of fees had been suspended for the issuance of special permit to transport only during this period of the enhanced community quarantine. And all data generated are submitted to the interagency task force. And an addendum to this memorandum is Memorandum Circular 2020-15, of which Section 1 emphasizes that for all transporters with valid regular permit to transport for M1, M501, the pathological and infectious waste shall continue to haul COVID-19 waste and other pathological and infectious waste from healthcare facilities. And they are allowed to pass the checkpoints for delivery at their designated facilities. Likewise, upon expiration during the ECQ, the Enhanced Community Quarantine Period, a special permit to transport shall be secured online. So all TSD registration certificates handling the M501 or the pathological and infectious waste, which shall expire during the period covered by the enhanced community quarantine, shall automatically be extended for another 60 days. Application for renewal, however, shall be made immediately within 5 days as soon as the ECQ is lifted. For EMB 2020-16, which is now specific for the M501 waste or the pathological and infectious waste, is an amendment of the interim guidelines for the special permit to transport for registered transporters and registered treatment, storage, and disposal facilities, which house, treats, and disposes healthcare waste. So the coverage of the memorandum circular has been expanded from the islands of Luzon, which was specific in MC 14 and 15. Now in 16, it is now expanded to a nationwide coverage. In Region 11, we only have one accredited treatment storage disposal facility. That is the Maya Medwaste Corporation, and it is using a non-burn technology, pyroclave, in treating its medical and chemical waste for its air pollution source equipment. It has 2 units pyroclave medical waste treatment machines, commonly served by an activated carbon filter and a cyclone dust collector. It has also 1 unit pyroclave chemical waste treatment machine served by a cyclonic carbon sander system. As of April 26, Maya Waste and Clad Sanitation Services, the transporter, had a total volume of M501 or the pathological and infectious waste from March 20 to April 24 had treated 14.865 metric tons of waste. That is for the regular generators, for the issuance of the regular permit to transport, and for the special permit to transport, we have issued 17 spe special permit to transport, 17 within Davao City, and one in Davao Oriental. So the total volume is 32.013. We are all doing our best to eliminate, if not contain, the spread of COVID-19 virus. It is important that everybody does their share to take action to prevent further transmission, reoccurrence, and to reduce the impacts of the outbreak and support control measures. And as powerful agents of change, any crisis presents the opportunity to help us cultivate compassion and increase resilience while building a safer and more caring community. Maintaining a safe treatment, storage, and disposal facility is vital and should be strictly followed. It will help ease our fears of transmission. And as TSD, the provider, they should ensure safe operations, complete with the presence of emergency and contingency plans and the plan for continuity of learning. And these TSD providers should emphasize to their staff and workers the basic information of every pathological and infectious waste being handled by them, how it is transmitted, and how to prevent transmission. This includes the continuous health screenings of staff to ensure continuity of health of critical services. And to all the service providers, this includes the TSD facility operators, we as the regulatory agencies, the local government units, the hospital managers, stakeholders, and all. It is a time for us to do a reassessment or reevaluation of, of what needs to be done and what approaches to address this challenge. We may we all respond positively and address this challenge solidarily. It is difficult to imagine a place untouched by COVID-19 and easy to believe that we are all vulnerable to this invisible virus and to this faceless enemy. Therefore, to attain all possibilities, we should all join forces and actions. And to one and all, let us do our own share to put a stop to the COVID-19 virus. Thank you very much and good afternoon.
Thank you, RD Manuel, for the challenges that we are all in this together. So everyone should work hand in hand in protecting ourselves, also in protecting the environment through proper waste segregation, especially the healthcare waste. So after that, since we know that transportation of hazardous waste, especially waste from hospitals, are not suspended. In fact, they are exempted from the ban, the travel ban. May we know from the Centro City Environment and Natural Resources Office if the same is being done in the local government unit with regard to our municipal engineer Lacandiwa Orculio of the Centro. The floor is yours, sir.
Good afternoon, no? Maayong hapon sa tanan. So, I hope everybody is okay, healthy in these times of uncertainties, in this period of uncertainties, no? Because we live now on a period of uncertainties because we do not know when this virus will disappear, when kailan yung ECQ natin matatapos. We are living in times of uncertainties actually. But there is one thing certain for now, it's the changes, no, in the usual management, in our usual management of daily activities, wherein we are now living in that so-called new normal that aims at flattening the curve, preventing the spread of infection, and we live on many protocols maraming protocols ngayon, not only sa diagnostic and treatment of COVID-19 patients, but also on our daily activities. No, when we go out, we go to shopping, social distancing is implemented. We should wear masks, and there are also protocols that involves handling and disposal of waste, especially sa healthcare waste. So basically, sa garbage collection, here in Davao City, we are implementing City Ordinance 0361-10 as well as RA 9003, also known as the Ecological Solid Waste Management Act of 2000. And I would like to clarify that based on the definition set by the our RA 9003, per definition of solid waste, let me read that to you. Solid waste shall refer to all discarded household, commercial waste, non-hazardous institutional and industrial waste, street sweepings, construction debris, agricultural waste, and other non-hazardous, non-toxic solid waste. The term solid waste, as used in this act, shall not include, number one, waste identified or listed as hazardous waste of a solid, liquid, or contained gaseous or semi-solid form, which may cause or contribute to an increase in mortality or in serious or incapacitating reversible illness or acute chronic effect on the health of persons and other organisms. Number two, infectious waste from hospitals such as equipment, instruments, utensils, and fomites of a disposable nature from patients who are suspected to have or have been diagnosed as having communicable diseases and must therefore be isolated as required by public health agencies. So our office is not actually collecting infectious waste from hospitals based on RA 9003 as well as City Ordinance 0361-10. But nevertheless, our garbage collectors are also facing risk in this pandemic because garbage collection cannot be work at home. So kailangan talaga silang lumabas. Their work entails high exposure to proximity to people. They have to go out and they are exposed to germs and viruses all the time. So, and there is that, even if what they are collecting is not medical waste, there is really that notion that they may be able to collect contaminated waste, contaminated with coronavirus, especially from the household. So because there is a study that reveals that the virus can live on surfaces of materials for days, like for example, for steel, 48 hours, for wood, 4 days, plastic, 5 days. So all of this, even garbage, all of these things may carry the coronavirus disease. So there is really that risk to our garbage collectors. So here in Davao, the city government recognizes solid waste management and garbage collection as an essential service to the people and to continue despite of the quarantine. So among of our personnel that is continuing reporting to duty are our garbage collectors, of course, drivers of garbage trucks, then sanitary landfill personnel, monitoring personnel, our dispatching personnel here in motor pool, as well as our motor pool personnel, mga mekaniko, vulcanizing, and some of our street sweepers. So we have implemented protocols even before this COVID-19 disease, because we always look at it that garbage could bring diseases to the garbage collectors and to their families. So we have implemented protocols and we are strengthening these measures, especially now that we have the COVID-19 disease. So first is we have dispatched garbage bins to our quarantine facilities, especially to facilitate segregation sa hazardous and the general waste, because we are actually collecting general waste even from the quarantine facilities. So we only collect the general waste which are placed on the black bag. The rule there is that during collection, the garbage collector should not open the bags, so dili paglihan. And this garbage is brought to the sanitary landfill, and they are buried. So namatay, we have a backhoe there. Before we throw the the general waste to the sanitary landfill, we dig a hole and throw the garbage from the quarantine facilities and recover. Then our office do not collect yellow bags, no. So I already stressed that one before. So we do not collect infectious waste, hazardous waste. However, to facilitate protection to our personnel, the office provides PPE. So we have done this previously. We give gloves to our garbage collectors, boots, as well as vest. Then, ginawa nating mandatory yung mask. No? So, kailangan naka-mask sila. Then, as much as possible, we implement visual protocols during dispatching and during collection, social distancing, then hand washing as much as possible as after collection. And if the personnel is feeling sick, the protocol is not to report on duty. Then for those personnel who comes from the lockdown areas, like for example, Barangay 23C, Barangay 21, of course, we do not expect them to report to duty. So we understand that. We also have a nurse here in our motor pool area. To even before the COVID, we do have nurse here to facilitate the immediate medical needs of our personnel, as well as the medicines. We have anti-hypertensive drugs, paracetamol, and medical needs such as yung first aid, nasamad, wound dressing, etc. So that's the role of our nurse. Then our protocols has been emphasized over and over again by our in charge of dispatching and during the meetings. No? So for the transport of personnel, because we are under enhanced community quarantine, and there is no public transport, we have dispatched vehicles to fetch hatod sundo sa ating mga basurero. So to prevent spread of infection, para hindi nila madala yung mga germs doon sa kanilang individual houses, garbage collectors bring extra clothing, ilisan. So they change clothing upon going home. But before that, hand washing is important. And if it's possible to take a bath after duty and change on their fresh clothes before going to their homes. So far, there are no COVID-19 cases here on our central personnel. For our collection vehicles, regular washing sa ating mga sasakyan, regular washing is implemented after every use. Sa ating namang volume of solid waste, obviously there has been a decrease in solid waste volumes due to the close down of many business establishments. Households are the main generators right now of solid waste during this period. So the current number of trips or trucks per day, bumaba talaga from the 110 trips per day. We are down to around 90 to 95 trucks per day na lang. So malaki talaga yung binaba. Then in terms of recycling efforts, limited lang yung because hanggat hindi necessary yung establishment na ipa-open. So wala talagang mga junk shop masyado na nag-open. So right now our recycling effort is really low. So because we are on standstill, many activities are on standstill. So that's it for our office assembly. Thank you.
Thank you, Engineer Orculio, for those information. So the questions we have posted to our chat will be read later, and maybe we will ask those persons who ask the questions to deliver them themselves. No, katong mga questions na to. And may I request everyone na kung pwede i-mute nato ang ato ang microphones, no, para dili ta makuan sa dili magkompetensya ang atong resource person sa atoa. So thank you, Sir Engineer Lacan. So prior to the COVID-19, no, naatay measure na ginalabi and actually na kuan na siya sa City Council through the uh, city environment through the chair or the Committee on the Environment and Natural Resources Office, no, katong ban on the single-use plastics. So tungod aning COVID, murag wala jud siya na push through or nadayon tungod kay ang sessions lagi nga na. So may we request for an update, no, with regard to the ordinance on the ban of single-use plastic. May I request Councilor Gislado Mejipos Jr., the Chair of the Committee on Environment and Natural Resources. Sir?
So, good afternoon, Attorney Mark. Good afternoon to everybody. Thank you for EDIS for inviting me to join your online forum on waste management during this time of the COVID-19 pandemic. I think this is really timely because as we take care of our people and their health, we must also continue to guard against the threats to the environment. No? And we must remember that health, sanitation, and environment are directly related. And I think talking about this at this point in time will also allow the people to be reminded of our shared responsibility in seeing to it that the planet will continue to be livable for everybody. And the present situation is an eye-opener for me, and I guess for most of us. And this allowed a realization that beyond our individual existence, no, we are a community. What happens to any one of us will affect our family, our neighbors, and even the whole planet. So I think as we heal as one, we must act as one in protecting and preserving life in this planet. Now, with regard to your concern, yes, our city has been in the aggressive implementation or project study of different plans and programs that would reduce our waste in the city. And one of this is the proposed ordinance on the regulation of the single-use plastics. That's true, no? Before this COVID situation, I was already going to submit to the plenary our proposed ordinance, but sadly, something happened. We have this COVID-19 pandemic, and right now, we cannot pursue this given that we are operating in a limited fashion in the sense that our session are limited. No, we cannot really interact so much. Then we even have some problems with our committee hearings. We are yet to set up a system or our rules for teleconferencing. But be that as it may, the ordinance has been prepared already, and I will be submitting this if the condition will be best for its approval. Yes, Attorney Mark.
Okay, thank you, sir, for that update, no, with regard to the ban of the single-use plastics, and hopefully after the COVID-19 or after the HCQ will be lifted, no, mahuman nato ni tanan, we will push through that policy and ensure na ato ang waste mubaba jud, no, hopefully. So with that, in connection to the single-use plastic, we also invited the national coordinator of the Eco Waste Coalition, Ms. Eileen Lucero, to give us some a presentation on the effects of single-use plastics on our health, also especially on the environment. So, Ms. Eileen.
Thank you, Attorney Mark. My topic is on about the effects of the single-use plastics as a follow-up to the updates from Attorney from Councilor Mejipos Jr. So, What are the effects of the single-use plastics? As you will know, Davao City, next slide please. Okay, so Davao City's waste generation has increased from 990,703 tons per day in 2017 to 2.2% in 2018, which is almost equivalent to um, 1,012 tons on a daily basis. Residential waste account for the bulk of the total solid waste, which is 80.10%. And in each categories, prominent contribution from the use of single-use plastics has also been noted. And with this ECQ, it is expected to increase more on the volume of disposable. So since marami nagkalat yung mga disposable plastics, face masks, almost all relief are in the disposable, in plastic bags. So when we say single-use plastic, so what do we mean by this? Single-use plastic, next slide please. Single-use plastic are also known as disposable plastics. It is designed or placed in the market to be used only once over a short time span before being thrown away, disposed, or discarded. This was the same definition also used by Attorney Councilor Mahipos. And what are these top 10 plastic items na you might be forgotten kung ano ito? So these are first, food wrappers, plastic bottles, cups, so yung styro cups, bottle caps. You also have the shopping bags on the top 5. So, next slide. What is the plastic's end of life? Usually, plastics end of life are first being dumped, being landfill, some are being incinerated, and syempre, most is littered in the environment. So if it's littered in the environment, it goes anywhere from the oceans to waterways. And only 9% of all plastics ever made has been recycled. The rest is pollution. So next. So if it's single-use plastics, how long until it's gone? So you could see in your screen the estimated decomposition rates of common marine debris items. So plastics that we use and dispose of will be in for us for a very long time. For example, plastic bags. Plastic bags, we use it only for 6 minutes. When we go to the market, we just hold it for 6 minutes on our hands. But then it lasts 20 years in the environment. Same with the styrofoam cups that last 50 years. Plastic bottles for 150 years and so forth. And we know it. For the diapers and the disposable face masks, almost 450 years also. So imagine if we're in the ECQ now and lots of people are using disposable face masks and using all this single use, for sure we will be ending up in a massive trash later on. So next slide. So what would be its effect? Um, as a matter of fact, yung plastic constitutes for the ocean approximately 90% of all trash floating. It means 46,000 pieces of plastic per square mile. And it is equivalent to one garbage trash worth of plastic getting dumped into the ocean every minute. If this trend continues, um, seafood lovers would be ingesting up to 780,000 pieces of plastics a year by the end of the century. And not to mention Davao City and the whole Mindanao is seafood regions. So definitely there would be an effect in the oceans. So next slide. There have been also some studies that have been documented ingestion of plastics by the wild fish, beehives, and crustaceans. If this is so, humans would be ingesting 11,000 tiny pieces of plastics a year with unknown health consequences. For example, tuna. There's lots of tuna in Davao City. So tuna, it's a very large number of lower tier fishes during life that can last up to 50 years. And they accumulate microplastics in their bodies. not only in their stomachs, which we don't eat, syempre, but then we eat their meat. And these plastics were accumulated in their meat. Okay, next slide. There's a 2018 human report that reveals the environmental problems associated with the single-use plastics that includes toxic emissions from the production, distribution, and disposal with the burning of plastic waste. And with the continuous use of disposable plastic items such as foam cups and plates, nanoparticles can leak into the food and ingested by the body. There's also evidence that toxic chemicals are being added during the manufacture of plastic transfer to animal tissue, eventually entering the human food chain. Kaya if you would see on the screen on your right side, there's this caricature that says that in a grocery that he already has a fish on hand, but then he is still asking for a plastic bag. But then the teller tells him that the plastic bag is already inside the fish because the fish already inhaled the plastic bags. Not to mention the second slide, the plastic packaging that we, next slide please, not to mention the plastic packaging which are now being used for our home food wrappers contains thousands of chemicals including at least 148 highly hazardous substances. And this packaging can be seen in all the food wrappers that we already have now. So they are the sachet. Okay. So what is the effect of plastics in our landfills? Okay. So as far next slide, as far as I know, Davao City's landfill is already full. It's already filled up, and plastic dump in landfills last for more than 100 years. If you would see in the screen, even the smallest dump is still colorful with plastic, and it's not degrading. Household and commercial products, usually packed in sachets, in multi-layered laminates, are considered residual waste and is hard to manage or recycled. This residual waste will accelerate the volume of garbage shown in our landfill in 2 to 5 years' time. So if Davao City's landfill is already filled up, because of the solid single-use plastics, it will double time and will easily be filled up again. So what about our waterways? Next slide. What the effect on our waterways? These single-use plastics that we just use once will pile up and end up at our canals and waterways. Improper waste disposals will also result in clogging of the major canals in the city that usually cause flooding and the negative effect on the environment. Remember, we are still in the COVID-19 pandemic and monsoon season will still going to affect our country. In 2019, in Davao City, the Ancillary Services Unit or the ASU raised alarm over the disposal of plastic waste in the city, whereas daily declogging operations of major canals in the city recovers around 3.5 tons of plastic daily collected. Aside from the regular cleanup done by the Bantay Dagat personnel in the coastal area of Barangay 23-C, that has a regular collection of 133 sacks of waste. Indeed, this is very alarming because if we're not going to stop throwing garbage to canals and everywhere, especially in the upstream, it will eventually go downstream, which will affect our waters, kill our fishes, and live in there, all the life in there. So, what can we do? If actually the issue of single-use plastics can be avoided. And so, next slide, what can we do? There are lots of ways and alternatives to single-use plastics. And by choosing to be sustainable, we do not only care for ourselves. It's time to reshape the Bohemian's behavior with increased awareness on the need to cut down on plastic use and the overall disposable culture. For example, one reusable bag, if you just use one reusable bag, you will have for a year save 783 plastic bags. So that was on an individual basis only. If you will just use one reusable bottle, 83 plastic bottles, you will be saving it. So finally, support a citywide ban on single-use plastics. It will have impact with the city's daily waste generation. Such law is needed to stimulate and strengthen actions by local government units to address the scourge of throwaway plastics. Said ordinance by Councillor Mahipus should set a phase-out target and timeline, promote alternatives, and provide incentives to encourage consumer industry shift to eco-friendly products and packaging. Um, Maraming salamat at naway lahat ay nasa mabuting kalagayan.
So thank you, Miss Eileen, for those information. Okay, we are now in our open forum. So there are a lot of questions no pending sa tuwang chat box. So isa-isa ho nato ni siya para matubag jud ta ng mga pangutana no kay pasig dili ta makatulog later. These are not answered. Na a question diri, I think this is addressed to RD Manuel with regard to registered transporters. A question from Ms. Lorna Maxino of the Water District. Who monitors the compliance of registered transporters?
EMB, the EMB regional office requires them to submit manifests and pictures online because of this COVID-19 enhanced quarantine that we do have here in Trans Community Quarantine. They all submit the reports online. So anyway, as of the moment, we only have one registered transformer, and that is the CLAD Sanitation Services.
So in Davao region, ma'am, or in Davao City alone? We only have one.
Yeah, only one. Only
In-
for the whole of Davao region.
Okay. So the EMB Region 11 monitors the compliance of these registered transporters through online submission of reports, ma'am?
Yes, but if there is a need to validate, you will be able to see from their reports, from their manifest and pictures online. You'll be able to take notice if there is a discrepancy. But as of the moment, since we are all direct to stay at home, we have to double check. We cannot risk our personnel to be going to the area because if they violate such law, they will be liable, no, upon uh, after this ECQ.
Yes, ma'am. So we are still business as usual in an unusual situation. So, ma'am, are these information available online? Can we secure a copy of it through what platform po?
You can contact our hash waste generator section. I will give you the link later on.
Okay. Okay. And there is another question from Mr. Climaco Jurado. He is from EMB Region 3. So from EMB Region 3, ma'am, is asking, can we know what is the estimated generation of health care waste of COVID-19 referral hospitals in Davao in terms of kilogram per day, per bed, or any possible unit of measurement? So I guess this question is addressed to the City Health Office, no? Or the Senro and also EMB. Sir Curtis, do you have?
Actually, the transporter gives the report to EMB. I think they have the exact data up to the latest because what we had with the latest with our healthcare waste management up to April 5th, up to the oh yes, April 15 was only around 40 tons. that would include the healthcare waste from the hospitals also. But for COVID-related cases, we only have registered around 2.3 tons as of April 15.
Okay, sir. RD Manuel, do you have data on this po?
As of the moment, the special permit to transport issued to the 18 generators totals to, that is from March 25 to April 24, totals with a total volume of 32.013 metric tons. That's the total volume of the M501 treated by Maya Med Waste Corporation and transported by the CLAD Sanitation Services. That is for the special permit to transport. For the regular permit to transport, we have a total of 14.865, the total volume from 4 generators.
Okay, thank you, ma'am. Thank you, Sir Curtis, for that information. And we also have a question here. I think mas mabuti kung si Miss Jill Banta. Miss Jill Banta, you may unmute your microphone and ask the question regarding the large hospital in Davao. Is this in Davao City or in Davao Region with regard to yung human body? Yes, ma'am.
Hello.
Yes,
Hi,
ma'am.
I'm Jill from Break Free from Plastic, Philippines. So I received information that a large hospital in Davao City incinerates human body parts and needles as part of their waste management procedures, no, in order to protect waste workers from hazardous waste. I'd like to ask, no, if these practices are acceptable. Um, incineration, no, of some select medical hospital wastes.
RD Manuel, do you have?
Per record of the office, there is no hospital in Davao that has an incinerator, a hospital. However, the use of incineration is acceptable as long as the minimum temperature is 900 degrees Celsius to destroy the dioxins that can be emitted during the process. So the practice in Davao City is that the crematorium, no? The crematorium does the cremation of the bodies.
So there was no record, ma'am. There's no record of a hospital incinerating human body parts and needles.
If you know that there is, please report to the office, because per record we have no hospital that has an incinerator that does this thing. So it is a violation if they do, because it should be properly recorded by the office.
Do we have other response from our other resource persons? Sir Curtis?
But the parts are usually buried, no? If not, it should be cremated. They're never, because we don't really have any hospitals for that matter that practices incineration in the city.
Oh. Okay, so there is no hospital engaging cremating human body.
Yes. There is no
incinerating
human body. Yes.
Okay. So I guess this needs to be validated. No, I think Miss Jill Banta, you may contact City Health Office or EMB with regard to this report so that it can be validated. And another question here addressed to the DNR EMB from thank you, Miss Jill. From Mr. S. Sir Ronnie, you may unmute your microphone and throw the question regarding the innovative measures DNR, EMB, and Sendro.
Okay, good afternoon. This is just addressed to the DNR EMB because I'm currently having our study in the USEC regarding the innovative measures that is being implemented to stop the circulation of the causative agent of COVID-19, particularly in the waste management disposal. Address to EMB and the city and province. Thank you.
Okay, thank you. There is a new memorandum issued by our Bureau Director with regards to the enhanced waste treatment facility, no? That there is a need, no, for the waste treatment facility, disinfection on the last stage of the waste treatment facility. So we have already issued a memorandum to that effect, no? Yun yung ang ginagawa dapat. And in collaboration with that, the DILG had issued a similar order for that.
Okay. Engineer Orculio, do you have an additional information?
When it comes to innovative measures, we are talking about innovations. When it comes to technology, we do not really have that technology to help to assist to stop the proliferation of the COVID-19, because if I am to put it, we need incineration talaga to get rid of the COVID-19. But as of now, we do not have the technology. But for now, it really relies on the measures that we take, that the solid waste that is generated would not cause or spread through the garbage collectors, and it can be transported to the sanitary landfill in a manner that there is no spread of infection. So that's the essence of talagang we have to take measures. So thank you.
Okay, thank you, RD and Engineer Orculio. So next question, Sir Ronnie, you may proceed to your next question. This is a nice question, by the way. Yes. Please unmute your microphone, Sir Ronnie.
Okay, this is just related. My next question is, do we have any cases of COVID-19 infection in Davao City involving garbage collectors as of date? Because we all know that garbage collectors are also frontliners in terms of our garbage disposal, especially in the located in the hospitals or in the area where there are cases of COVID-19.
Engineer Orculio?
Yes.
Sa ngayon wala. We do not have cases of COVID-19 infections sa atong mga garbage collectors or any personnel sa SEM.
So, sir, question lang, how do you ensure, sir, na kaning mga garbage collectors nato are properly, are safe, no, sa infection or sa kaning COVID-19? Unsa atong ginabuhat, sir?
As I mentioned earlier, they have to yung PPE, you have to wear the PPE in collecting. They should wear the gloves, mask, vest, boots. After their duty, they have to change clothes, hand washing, pwede, social distancing sa tamang garbage collector, and all these things have to consider contamination sa kamay, never to pick up the garbage, useless din ka, may gloves ka, touching everywhere, contaminated, so you have to change clothing.
Thank you, sir. No, so we should also ensure the safety, no, of these garbage collectors, because they are also frontliners, as what Sir Ronnie said. So another question. Oh, there are two questions from Miss Jill Banta. Miss Jill, you may unmute your microphone and you may ask the question regarding the hazard pay.
Okay, hi again. So just concerned, no, do waste collectors also get hazard pay? And another question is, how are Davao residents informed about segregating medical wastes, no, such as face masks or gloves from normal waste.
Engineer Herculio, maybe you can answer that.
Um, as far as I know, no, the garbage collectors for now do not have that hazard pay. No, if it's possible, we could brought up that matter. We have a counselor here, Counselor Mahipos. So for now, I asked our admin officer about if there's a hazard pay for garbage collectors, and her answer was currently wala pa daw, wala daw instruction na may hazard pay. Then the question is, how do we inform the households on segregating medical waste and some mask? Well, generally, the mask and the gloves from the households, which means hindi siya medical facility, are combined with the general waste, no? Because we do not have separate collection para sa mga household hazardous waste, especially infectious waste. May infectious waste generated from the households. So these items are disposed along with the general waste and transported to the sanitary landfill in a manner that as much as possible the may precautions sa garbage collector na collect na hindi ma-spread ang disease. So that's it. Thank you.
Thank you, Sir Engineer Herculio. No, so Dabawenyos should also be informed on how to manage their waste, especially katong mga mask na ginagamit nato o katong mga gloves, no? Kay possibility na ana siya yung mga sa matawag ana sa COVID, no? So pwede pa na siya makatakod if dili siya properly managed. And siguro nakapaman si Councilor Mahipos diri. So basig pwede na to siya mapangayuan o comment niya with regard to hazard pay aning mga garbage collectors nato, no? How is this possible, no, sir, no? Unsaon nato pagbuhat ani?
Okay. Maayong hapon usab, no. Bahin sa with regard to the question on the hazard pay for our Senro garbage collectors, I believe the President of the Philippines has already issued Administrative Order number 24 or number 26, if I'm not mistaken, that granted these workers engaged by the LGU, either through job order or contract of services or other similar schemes, the premium pay, no, in the form of a hazard pay. So kining ato ang our garbage collectors usually are job orders, no. I believe the LGU will be appropriating an amount sufficient to allow them to receive this hazard pay, because this is already an administrative order issued by the president. So antayin lang natin yung with regard sa mga budgetary requirements, but I'm sure that the city is looking after the welfare of these garbage collectors also.
Yes, thank you, Councilor. No, so there is already a administrative order issued by the or executive order issued by the president with regard to premium pays for job orders, especially which is appeal ang ato ang mga garbage collectors, no? Pwede sila maka-avail ani, and we'll just wait for siguro executive order from the mayor or any guidelines on how they can avail this hazard pay, and hopefully mahatag sa ila. And we also have another question from Mr. Josh Mamans. Yeah. Sir Josh, you may unmute your microphone and please ask your question. Sir Josh? Siguro wala si Sir Josh. Sige, ako na lang mag-question. I think this is addressed to EMB and also Senro. Do we have siguro data daw on waste generated during this ECQ? unsa ba nagtaas ba siya or nagbubo? And however, when we give the segregated garbage to the collectors such as disposable mask, they still mix it with other garbage. How do you monitor such practices? Or do you have garbage areas specific to this kind of waste? Engineer Orculio?
I think the question was much waste were generated during this CQ. So daghan gyud ang basura na generate, and a lot of them are disposable, no? Disposable masks. So I already answered this one earlier. We do not have a specific separate collection for mask, no, even gloves, and we because the households are not medical facilities, we consider this as sources of general waste lang. So they go along with the general waste, and we do not have a facility in the landfill to separate the the hazardous waste, if it is hazardous or not, because we only have the sanitary landfill for all our general waste.
Thank you, Engineer Orculio. And another question from Miss Lorna Magsino of the Water District. Ma'am, Lorna, are you still with us? Okay. I think this is addressed to the City Health Office or the EMD. How do our health facility dispose properly the liquid waste from COVID-19? Yes, Engineer, Sir Curtis.
Liquid. Do I hear it as liquid waste?
Yes, sir. Liquid waste.
Basically, liquid waste goes into the general drainage for any establishment. However, our concern really is on the healthcare waste, which are solid healthcare waste. These are, as I said before, these are collected by a special transport group and treated at their site in Carmen, Tubo.
Okay.
Presently,
I think so. Yes, sir.
presently,
Yes,
I would reiterate the isolation centers or the COVID stations that we have were not really built for this, because this is a new crisis that has just arisen, and we had to make to determine some areas where we can facilitate all these patients only.
Yes, thank you, Sir Curtis, for your response. Miss Katrina Castillo, ma'am, are you with us? Are you still with us?
Hi, hello. Can you hear
Yes. Hi.
me?
Hello. Yes, po, ma'am.
Hi. So my name is Kat. I'm from Plastic Free Davao po. I'm a resident of Davao City mismo. So I've noticed kasi in the recent days that there is really, in fact, a very high increase of the disposable na mga objects na ginagamit sa hospital, because I am also from the medical field. So, aside from that, there's also increases in takeouts in the community sa Davao. So, is there a way that the government or maybe private sectors are trying to find a way para ma-offset ang increase of the plastic consumption during this time of COVID? Kasi even though we are in a very bad situation at the moment, we still have to think of the next effects of our consumption now, because for sure, like the speaker said about single-use plastics, there will be effects in the future. So I wonder if there's already a plan in gear that might help us to offset the increase in the use of plastics. So yun lang po.
Thank you, Miss Katrina. So I guess Engineer Lacandiwa, you have a response to that question?
About plastic? Anong nasa chat box ba yung ano?
Yes, sir. Yung question niya is, how are we segregating the infectious waste from the home setting, where will they go since usually the hospital disposes them individually? I think mayroon pa siyang follow-up question. Yes, Miss Katrina, ulit na po yung question.
So, sir, so basically my question is that in recent days kasi po, there's an increase in plastic not only in the hospital setting but also in the private setting, because there is already, for people to get their commodities and their needs every day, there is more takeout. So what are we going to do in the future so that we will offset this problem of increased use of plastics?
There is already a ordinance pending sa City Council about banning plastics.
Yes, sir.
We have to wait for that, act on how we could further reduce our plastic consumption. But with regards to segregating infectious waste from the home setting, for now, I think we should look into, the city should look into what we could do about segregating infectious waste from the households. The fact that households also are generating infectious waste, syringe, especially sa mga diabetic patients, sa mga masamad. So we really generate infectious waste, and this is one of the things that the city should do, them segregating infectious waste, that they do not go along with the general. Now, since hindi man hospital setting ang household, all of the waste go to the sanitary landfill.
Is it clear, Miss Katrina, na ano po ba?
There's another question though. To make it a little bit clear, my question is for the generation po at the moment, since there is an increase of it more than usual. Because if you ask me po, when people are eating when they're eating inside the malls, for example, usually their plates and everything are reusable, and they don't usually ask for plastic because it's more often than not they actually dine in the areas. But ngayon po is medyo increased ang ating mga takeouts. Like for example, today po, we usually can opt for plastic-free na options in the grocery stores, but everything that we bought right now is in plastics. So what are the parang guidelines or mga plans ng government so that we can help na ma-reduce pa yun sa future, or like how is it going to be disposed, that high amount at this moment? Mataas yung amount po, paano natin siya i-dispose?
Actually, we do not have the data as to if there is really an increase on plastic waste generation sa household, especially on this COVID setting. Actually, per our dispatching personnel, ang garbage natin actually nag-reduce because a lot of the establishments are not operating, no? So households na yung nag-generate. Although there is an increased generation siguro sa households, but we do not have the data as to how much yung nag-increase in terms of generation. Siguro if marami kasi plastic, if it's PET bottles and yung mga recyclables, even if lockdown ngayon, so wala masyadong open ng mga junk shops, yung mga nagko-collect ng mga recyclable. So perhaps we should ipunin muna sa bahay. Hindi natin itatapon yung mga recyclable na yan because they have value. So, for now, the rest, mga plastic, sa sanitary landfill talaga. So, did I answer your question?
Yes, sir, actually. Simply by telling me na with proper information na there is actually a reduce in the waste, that partly answers the question that I have po. Okay.
Thank you, Miss Katrina and Engineer Julio. I think may response from one of the resource person, Miss Eileen. Do you have anything to say po?
Yes, I just want to add, in order since there's a pandemic and not everyone are allowed to go out, so the way to visualize how much plastic waste have been increased in during this period. So you could multiply it dun sa number of barangays, number of population times the number of relief, the number of ayuda, di ba? They are telling there are 3 times of ayuda. So all of those relief are packed in plastic bags. And not to mention, there are lots of takeout orders. So I think in this period, what we can do is first, if we're going to the market, we bring our own bayongs or we bring our own reusable bags. That way you could help lessen the volume of plastic waste. Second, if there's an mobile palengke, do not use plastic, avoid it. Bring your own. You could bring also containers for the meats, for the fishes that you bought. Um, Lastly, avoid takeouts, avoid orders. You could maximize your spending power, the reliefs by having your own budget, cooking your own food, patronizing local products, especially yung mga farmers within the Davao City. They also need your help. And it's two-way. You reduce the plastic waste and you also help the local economy in Davao City. As for the disposable na infectious like face mask, um, face masks and disposables are considered infectious waste under the DOH guidelines on safe management of the hazard of infectious waste. Wala man ito dun sa, it is not household waste. Face masks and gloves are never considered household waste. So therefore, it should not be included in the regular waste. So what to do, since just to avoid it, what you can do is put your used face mask and gloves in a yellow bag, label it so that the garbage collector, when they pick it up, they know that what is inside is hazardous and they would not mess with it. They would not handle it. So in that way, you put the safety of the garbage collectors from other infectious waste, because if you would know where the garbage collectors are faced not only with the pandemic, with the COVID-19 virus, but also faced by other infectious virus, which other constituents from Davao City would be having. So, in order for everyone to be safe, it is much better to segregate it properly, put a label for those infectious face masks or gloves that you use. Thank you.
Yes, thank you, Miss Eileen, no, for that additional information. We have a response, Sir Climaco. Balik po tayo dun sa may liquid waste. Sir Climaco, are you still with us po? Yes, please unmute your microphone. Yes, with regard the liquid waste po, sir. Baka meron kayong information to share.
Yes, good afternoon po. Base po sa EMB po, nagbigay naman po ng directive ang aming director na nire-require o dapat magkaroon sila ng adequate treatment ang lahat ng mga establishments bago nila i-dispose yung kanilang wastewater o yung liquid waste. Based din po kasi sa study, although sinasabi ng study na wala ng World Health Organization na walang evidence pa na nakita na ang COVID-19 ay present sa ating mga water bodies, pero ninanais pa rin po natin, sinisigurado ng EMB na lahat ng mga wastewater treatment plant ay meron silang adequate disinfection. It's either chlorination o kaya yung UV light para ma-disinfect. Kasi alam naman po natin yung COVID-19 is envelope type na virus na namamatay naman po siya using the usual disinfection method. So yun lang po. Maraming salamat.
Thank you, sir, for that additional information. And hopefully na sagot na yung previous question with regard to liquid waste. So there's a question kaganina from Miss Kat regarding offsetting. Maybe we can hear from Councilor Mahipos. Kaning question, sir, on the increase in food takeout. How do we offset the increase of plastics in these COVID times, considering the next effects in the future? And do we have plan ba daw to offset the use or disposal of plastics?
Well, Kat, good afternoon. Kumusta ka? With regards sa generation at sa garbage, no, especially sa plastic, I think tama si Engineer Orculio. We do not have the data yet, no. Especially with regards sa hospital generated plastic, because I understand from Mr. Sir Curtis that the hospital waste generated because of the COVID-19 treatment of patients, they undergo a separate procedure. They are not mixed into the common garbage. I think na meron silang facility to dispose of those infected generated waste. So ang ating concern na dito is yung mga house generated na mga plastic. We do not know if the assumption is correct, but since nag-lessen na yung consumption ng tao, I think mag-lessen din yung generation. Now, with regard to plastic bags, tama, no, meron tayong mga every 2 weeks or every now and then, the government is giving out rations and they are using the plastic bags. Yun lang, kasi we cannot think of any alternative as of now na mabigay sa mga tao yung bigas saka yung pagkain in other type of packaging. But of course, we are open to any suggestions. But right now, I think we are giving away 300,000 more or less food rations. So if there is any suggestion, there are any suggestions. But right now, I think the practical way of doing it, they are using the plastic bags. So I will just suggest perhaps to the homeowners, to the recipients of the ration food rations, na yung mga plastic bags, wag din nila itapon, kasi to mitigate the effect of the usage, we must encourage the reusage of the plastic bags. No? They can use it for some other purpose para lang hindi maging single use. That way, we can mitigate the effect of this. But sabi natin, wala na bang delikado, hindi ba nakakasama? Right now, yun nga ang problema. We are trying to find a way, but the practical way of doing things right now is yung yung as it is. Wala tayong makitang packaging na mapadali tsaka mapaabot sa tao yung tulong. I think that's the situation on the ground.
Thank you for your suggestions and for responding to the question. And I guess we don't have any more questions na. And may mga good recommendations sa ato ang mga participants. You can check that sa ato ang chat box, no? I hope the local government unit will consider these suggestions. And I would like to thank the participants for the wonderful questions, no? Ang juicy ang mga questions. Thank you for that. So before we formally close our webinar, may I request our resource persons for mga pa-ending, no, na closing messages ninyo sa ato ang mga participants. And also we are live in YouTube and sa Facebook. So naapoy nagatanaw sa ato aside from sa ato mga participants sa webinar. So Engineer Repulyo, pasig pwede nimo sugdan, sir?
First of all, no, thank you sa opportunity na maibalukod namo sa among part ang situationer sa ato ang solid waste management sa city. And actually daghan po mga inputs nga pwede na ito ma-implement, no? Labi na itong mingon ni ma'am niya na i-separate ang household na hazardous waste. So, which can be really be done. But for now, something pwede na ito na ma-adapt. I-recommend naman ito sa mga. So, hanggang tama ito, I hope everybody will contribute to the fight against the spread of this coronavirus disease, no? And we are all soldiers sa maong battle. Kung unsay may kabo sa isa sa tua, it will really affect the rest of the Dabaweños. So thank you very much.
Thank you, Engineer Herculio. Miss Eileen? Closing message po?
Okay. My message would be for the Baweños to include reduction of waste and avoidance of the single-use plastic in the new normal. We have lots of efforts, initiatives already made before. So let's continue this to the new normal. Daghang salamat at ingat po ang lahat.
Thank you, Miss Eileen. Councilor Mehipos, sir?
Well, again, salamat, no? Thank you sa IDIS and to our other resource persons and our viewers. Thank you very much for including me in this open forum. Well, I am one with you, especially with our advocacy in diminishing, if not totally eradicating the proliferation of single-use plastics, but we have to understand that right now we are delayed again because of the situation, but rest assured that we have a working ordinance already and this will be submitted to the plenary for further debates, and hopefully I will defend this so that this will be passed. Now, with regard to the concerns of our mga kasama, that right now there is a assumed increase in the plastic waste generated. Well, I am calling out, I'm not calling out, I am asking our viewers, the public, that bitag na ata sa pandemya, let us take care of the environment, because again, health, sanitation, and the environment, usa lang din sila directly related. And how we act and what we do, as we have now learned, will affect the whole community. Now, this happens in this time of a health crisis, but this is also applicable with regard to the environmental aspect of things. We should take care of the environment. Now, let us agree na let us reuse all the items that we come into contact with, no? Especially plastic items. Do not throw it away after a single usage. And also, let us follow the law on segregation. It doesn't mean to say that we are under quarantine, that the law will not be implemented. This is the best time to implement our practices on waste segregation. Okay, we have so much time in our hands sa balay. Now we practice, we train ourselves, we teach our children to segregate our garbage. And then especially, tama ka nga, Ma'am Eileen, yung sa ating plastic waste generated, we will try really our very best to think how to address this effect on the environment with regard to the distribution of plastic bags. But also, I would like to ask our public na even if without these ordinances, kasi kaya nga we cannot pass ordinances right now, let us be very cautious with regard to the usage of plastic. I-reuse natin o wag natin ihalo, or if pwedeng hindi na tayo mag-order na gamitin yung plastic, you call up your food delivery service and ask them not to put into the plastic bag your order, so that the food delivery service will know that they will serve the food orders as it is, na wala ng mga plastic bags. Let us try to reduce the waste, especially the plastic waste. Yun lang. Thank you very much.
Thank you, Councilor Mahipos, and we're very honored, no, that the regional director sa EMB Region 11 is with us right now, and naghulat jud si Ma'am hantod nga mahumanta. And RD Manuel, do you have any parting message?
First of all, I would like to thank the EDs and all other resource persons like Councilor Mahipos, and to all the viewers. And I would like to take this opportunity, likewise, to remind on my advisory to all the pollution control officers with regards to the enhanced wastewater management to combat COVID-19. So this is in accordance with Republic Act 9275, otherwise known as the Philippine Clean Water Act of 2004. So we have requested the pollution control officers of all industries to include in their submission of their self-monitoring reports a section regarding the status, the status of the adapted disinfection process. So we strongly urge that all personnel assigned to the pollution control, sanitation, medical hospitals, healthcare waste facilities, and all others should always wear the needed equipment and be equipped with the proper and adequate personal protective equipment as prescribed by the Department of Health and other authorized agencies. And I would like to remind each and every one that we all have a shared responsibility. Let us do our share to put a stop to COVID-19 virus. Thank you very much and good afternoon.
Thank you, RD Manuel. And last but not the least, from the City Health Office, Sir Curtis.
Yes, Tony Mark, thank you for EDs for facilitating this webinar, as we call that. I'd just like to repeat again to the public that the basic principles in really avoiding this disease is through proper hand washing, at least 20 seconds. Please be reminded always that proper hand washing by the use of soap and water is very, very important. The best that you can do to clean your hands, because normally we produce oil, and these viruses and other pathogens tend to stick to our skin, and it's only the soap that will break down its molecular component. That's why washing properly with water and soap is very, very important, and the use of alcohol should come as only a supplement or when there is absence of soap and water. And second, I'd like to emphasize also the use of face masks wherever you go when you're in public, especially when you are having colds or cough. And thirdly, we should always practice distancing, social distancing or physical distancing at this time of the crisis. It has been with us for more than a month, and we are all urging or wanting to live maybe a new normal life. So let's heal as one. Thank you.
Yes, thank you, Sir Curtis, no? So, ayaw sa maghawa tanan, ayaw sa aglib amuban, ayaw sa taglib ha, kay napatay snacks. Later. So, and then, syempre, before we close our program, we prepare certificates also for our resource person. And also, certificates of participation or attendance will be emailed to all participants who participated the webinar. So, hulat-hulat na ta sa ato ang certificates, no? To award, syempre, dapat awarding certificates. To award our certificate of appreciation sa ato mga resource person. Tawagon nato sa Chinky, Miss Chinky Golye, ang Executive Director sa IDIS.
Uy.
Sige, first certificate, naka-frame na ba siya? Ayan.
Ayan. Thank you so much to our resource persons. Before this webinar, medyo na may nag-uulmi and then na po paano kaya malahutay kaya ta. And we're very happy we're about to end na. So thank you very much to everyone. So our first certificate is a certificate of appreciation. To Councilor Justdado Mahipos Jr. Sir, thank you very much. We will try to print this and deliver to your office siguro in the future, but we can also email it para both you have copy. So thank you so much, sir, for being one of our resource speakers during the webinar entitled Flattening the Waste and COVID-19 Curve, an online forum on waste management amidst COVID-19 pandemic. So issued today and released via Zoom video conference. So thank you so much. Then another certificate is for, of course, another resource person. Ayan, Engineer Lacandiwa Orculio. Also an environmental planner. Thank you very much, sir, Orculio. And then, of course, another participant, another certificate of appreciation to Dr. Sophie Manuel. Thank you very much, Director Sophie. We are very happy to see you again online. And of course, we also have our certificate of appreciation for Sir Curtis de Zaraga. Thank you so much, sir. Nalahutay na jud ta. Nalahutay na jud ta. And of course, last but not the least, our active partner from the Eco Waste Coalition is Eileen Lucero. Sis Eileen, thank you so much for being with us and also for sharing with us your knowledge and expertise. So to all our resource persons, thank you. We will try to print all the certificates and deliver to your office. Pag normal na, hopefully we will see you soon. Thank you so much.
Hey, thank you, Ms. Chinky, for the awarding of the certificates. And basi pwede ta makakuan, paano ba ni mag-group picture ang kuan? Kinsa pa makakuan eh. Before ta mag-end, dapat natay group picture.
Oo nga eh. How do we do that? Ganyan ko na lang.
Grid to. This is how we do our meetings. Attendance check to. So, i-grid natin. Everybody.
Yes, grid.
Okay,
Oh,
so now we're in grid.
Okay.
Hi, good afternoon everyone. Grid, tapos, sino ngayon ang magte-take?
Ako na.
Okay, ikaw na? Ikaw na?
Yes.
Okay. Sige.
Okay.
First batch.
No, everyone can appear on the grid.
Everyone. Yes, agreed, yes.
Right? Tama ba?
Kasi may ano,
No.
nakadalawang tayo eh. Hindi
Ah,
ka sa isa.
Okay.
Yes.
Okay, first
Okay,
batch.
ready? 1, 2. Okay, next batch.
Okay, next batch.
Yung iba kasi walang mukha. Pero ayan, nakikita na. Please show us your face. Okay. Ready? 1, 2, 3. Okay. Okay, and last batch. Ayan. Okay, ready? 1, 2. Okay.
Ayun, okay. So to formally close our webinar, may we request the chair of the Board of Trustees of Interfacing Development Interventions for Sustainability, Ms. Madet Cardzola, for the closing message. Madet?
Mayong hapon. Can you hear me?
Yeah.
Yes, ma'am.
But you can't see
Yeah.
me. Something happened to my video, but magandang hapon. Mayong hapon po, gikan diri sa Tagaytay. Nako sa Tagaytay na lockdown.
Wow.
So maraming salamat sa ating resource persons, no. Sabi nyo nga, kahit na nandito tayo sa ganitong sitwasyon, we are able to find ways of continuing the advocacy and the work for waste management and the ban on single-use plastics. So today, we appreciate the inputs, no, from Senro, from Engineer Orculio, from um, Curtis Lazaraga ng CHO, at saka Dr. Sophie Manuel. Thank you for being with us. Of course, si Consi Mahipos, salamat po. At kay Eileen, hello Eileen. So nakita natin, no, ay, wala nag-summarize, no, pero kumaiglit lang to. Technically, we saw, no, we have been dealing with this problem ever since, but now because of this situation, things are more challenging, sabi nga. Dahil nasa crisis sa COVID, no, technically may nakikitang nag-increase yung volume ng wastes, hindi ma-determine kung dahil sa medical sa mga PPEs, no, or other use, but technically may increase talaga, no, ng waste. Sabi nga ni Eileen, 1 million, more than 1 million tons daily na ang Davao, pero it's expected to increase some more, so that's quite disturbing na, no. Then legally, yung ating advocacy, kita natin sinabi ni Konsihal Mahipos na delayed yung ating ginagawang pagpasa noong ordinance, no, on single-use plastics. Culturally, we know that we have to continue because we are trying to change and reshape the Baweño culture in terms of waste management. So, and I think that's what everyone was saying, even while doing the technical and legal work. Yun yung importante. Gusto ko lang sabihin how important the work of waste management is, no? Especially at this time. Meron po akong kaibigan sa Canada. Alam niyo, nabalitaan niyo ba yung recently nagkaroon ng mass shooting? One of the deadliest in sa Canada, it's the deadliest. So sabi ng friend ko po, one of the things that's really appreciated is when the garbage truck collector came. Sabi niya, bakit? Because that gave her a sense of normalcy. Things were getting normal. We're going back to normal again kasi may nangongolekta na. For a while kasi talagang sarado lahat ng bahay because of the threat of security. So parang ang trabaho po natin sa waste management, from the frontliners to the legal work that we're doing, ay napakahalaga. That's what I'm just trying to say. And siguro to underscore also yung sinabi ni Eileen kanina, we're waking up. We're always saying we're waking up to a new normal. And there's an opportunity to create that normal based on what we want to change in our culture, in our ways of doing things, especially sa waste management. So, gamitin natin to, lalo na buti na lang may webinar, we can continue to really design ano bang new normal sa lahat ng aspeto sa environment. One that will fit and be beneficial to all, even nature, no? So ayun po yung ating pagsikapan. That's what we can try to work on collectively. And again, sana magpatuloy pong webinar kasi ito yung space natin to create that new normal in the things that we're doing for the environment. Right now, this is our space. In the future, we can claim the new normal that we have created through this space. So thank you very much. Good afternoon sa lahat.
So thank you everyone. Thank you sa mga resource persons for spending your time and sa pagkuanjud sa oras ninyo diri, no? And thank you everyone for listening and hopefully naadyo na kuha karon nga adlaw. And magkita-kita tapuhon na pod another webinar siguro, and we'll think of other topics to be discussed. And see you after CQ. So thank you so much everyone. Bye-bye.
Thank you. Bye.